Welcome to the Journey Line podcast, where we hear the stories of athletes, leaders, and change makers, exploring the highs, the lows, and the defining moments that shape who they are today. I'm your host, Matthew Gibson, founder of Connecting the Dots, an initiative helping athletes unlock their potential both in and out of sport. On each episode, our guests share their journey line, a map of their story that highlights the challenges they faced, the lessons they learned, and the resilience that's carried them forward. This show is powered by Stillwave, a mental health and wellness platform created by athletes, for athletes, and for anyone striving for wellness. Be sure to subscribe, like, and follow so you don't miss a single conversation. Welcome to the Journey Line podcast. Today I am with Dr. Kelli Uitenham. Don't want to mess that up, Dr. Kelli Uitenham. Thank you for being here. I want to do your introduction, give you your flowers, and then we'll hop into the conversation.
All right. Thank you. So excited to be here. Thank you for having me.
Yeah, thank you for being here. So Dr. Kelli Uitenham is an assistant clinical professor at Northeastern University, a certified medical speech language pathologist, and a certified brain injury specialist. She is also the founder of the Brain Talk Foundation, owner of Serenity Speech Therapy, and host of the weekly podcast, Candid Conversations with Dr. Kelli. Her work focuses on brain health, concussion, and equitable access to rehabilitation. Please welcome Dr. Kelli.
Thank you so much. That's such a nice intro. Thank you.
Yeah, no, it's great. I think it does wonders, right? And
yeah.
So I like to give a brief story of introduction, how we met, that type of thing. So I think it was around this time last year I met you.
Yes.
Ricky Singh and DeAnthony Logan, my brother's keeper, they were like, hey, Matt, I think you should be a part of this cool event happening called Brain Talk Day. And I was just like, sure, I'll check it out. Then that's where we met, and you had this great idea, in my opinion, about Brain Talk Day. And I was able to help support you with that, but at the same time, be a part of what I felt like was a really just a great event that educates the community about brain health. And for me, being a former football player, I felt like that was like one of the ways. I didn't realize there was so much I didn't know when it came to brain health. So I say all that to say, I learned so much from you, and I was just grateful to be a part of it. So thank you for being on the show, and I'm excited to, just get into the conversation and just chop it up with you.
Well, thank you. Yeah, that was a good time. And yeah, it was about a year ago, but I remember you were on campus and Ricky introduced us in person, and I was just thinking really tall. So when he was like, he used to play football, and I'm like, that makes total sense. But I love that we've been able to continue our friendship since then and support each other and come to each other's different events. So I'm I'm excited to be here. Thank you for inviting me on.
Yeah, absolutely. Yeah, you were at Connecting the Dots, the mental health summit that we had back in April. You had the goggles. That was a big hit, actually.
Oh, good.
The goggles were a big hit.
People love the goggles, the concussion goggles. They simulate what it's like to have a concussion. So people are always excited to put those on. And people who have had concussions, athletes specifically, they're like, yep, this is just like it. This is what it feels like.
Yeah, absolutely. So, I like to ask people, I don't really like to ask people, who are you? I kind of like to be a little creative and do it differently. So on the show, we ask people, what is your journey line? And so that is essentially me asking, like, who are you? So like, give people a high level overview of who you are and how you got to this place.
Okay. Well, I won't repeat because you did a pretty good job of saying some of those things, but I am a Cleveland gal, hail from Cleveland, Ohio, and I have been in Charlotte, North Carolina for almost 30 years. I moved down here when I was pretty young, and then let's see, I was a journalism major. I went to North Carolina A&T State University, so Aggie Pride. Yes, always Aggie Pride. And from there, I did a stint at being a starving artist and did my modeling and acting thing. I'll tell you offline what movies I've been in.
Okay.
People always want to know, and then they send me screenshots. I'm like, oh no, this embarrassing time. Yes. And then from there, I realized that journalism and acting and starving was not for me.
Okay.
Journalism, yes, was for me, but I ended up graduating when the big crash was happening in 2009. So that took me to grad school.
Okay.
And I ended up falling in love with speech therapy. And I've always just had this affinity for the brain, even when I was a young grad student. And I had an interest in the sports piece as well, because I am a former athlete. And then hearing about how athletes are not educated or well versed in the severity of what can be happening to their brains. And so that always fascinated me. And then I ended up working with adults and working in the medical setting. So working with adults and geriatrics with various brain and neurodegenerative conditions like stroke, dementia, Parkinson's. And so that led me to do travel therapy and brought me back, and I was doing contract stuff, and then COVID hit. And because I was doing travel therapy, I ended up getting all of these licenses, and I was thinking, well, what can I do with all of these licenses to practice in these different states that I was traveling to? And so I decided to start a telepractice so I could use all those licenses. So I own a telepractice and get to see people around the country and sometimes the world if it's an accent modification client. And then from there, I was invited to speak at a conference, and I was speaking to my colleagues about brain health and CTE and concussion and the role of SLPs. And I was astonished at how many of us were not aware. And so I was thinking, well, man, like who else is not aware if it's my own colleagues that aren't aware of like how broad and deep our scope goes with this. And so I started poking around and asking, and a lot of people did not know. And so I was thinking, man, like somebody's going to have to raise the awareness. Somebody's going to have to let these people know. And I kept saying somebody, and then I looked in the mirror, I'm like, girl, somebody is you. You're just going to have to do it. And so I actually reached out to my wonderful manager, Ebony, and she was like, if you don't have a nonprofit, you need to get a nonprofit. So I started the nonprofit, and I've been going ever since.
I love that. It's so much to unpack in that journey. And you real life answered all my questions as you were unpacking.
Short episode. This was great.
So thank you guys for this is the Journey Love podcast. No, but I think for me, I like to go back and forth with certain things, but from Cleveland, right?
Yes.
Are you a Browns fan?
Of course I am.
Okay. So
you all out there, you listeners, be quiet. I am a Browns fan.
No, yes. I think that says a lot. That shows a lot about who you are as a person.
I'm loyal.
Literally. Like you can endure and continue to go.
Yes.
And have faith.
Yes. And have faith. Yes.
One day it's going to turn around.
Yes. But what I do is I don't watch the games because when I don't watch, we win, we do better. So I just hear about it afterwards. Like I do my best to even silence the alerts on my phone because then I'm going to want to look.
Yeah.
But yeah, I'm still a fan.
I get it though. So, I can appreciate a loyal fan. I am a Panthers fan, so it's not that much better, But honestly, we're on a little streak right now, so I got to give them their credit where credit is due. So I'm just like, keep it up.
Yes.
All right. So in terms of like, you becoming a speech pathologist, and you went over this quickly, but I do want to circle back when you were like on your Starving Artist days as like in journalism and things of that. So you were in broadcasting?
Yes, it was journalism and mass communication.
Okay.
And so I got into that in the 5th grade. I went to David Cox Elementary, and they asked for volunteers to do the morning announcements for a week. And I got to that desk and I was like, I'm home. So from 5th grade to 2009, like I was going hard for journalism.
I love that, but I can actually see that, right? I could see you on the news, introducing yourself, being on the news. And so like, I guess in terms of, I think you do a great job of enunciating. You just, you're well-spoken, all the things. And so I feel like helping people with speech pathology is probably kind of goes hand in hand. So with that, what exactly does a speech pathologist do?
Good question. Yeah. So broad question. So we have a very vast scope of practice, and a lot of people will hear speech therapy and they're like, you work with babies and teach them how to say rabbit instead of wabbit. And that is very true. So with speech language pathology, I liken it or compare it to being a doctor in the sense that there are different specialties. So I am a medical speech language pathologist. And so I specialize in working with adults and those different conditions that I spoke about earlier. So if someone has a stroke or a traumatic brain injury, someone who has difficulty with swallowing, that's a disorder called dysphagia. So if you have a stroke, last time I checked research, 86% of people who have a stroke are likely to have some sort of swallowing difficulty. And so with dysphagia, that is any time that food or liquid enters your mouth, and then the entire process for that. Processing, formulating the bolus, which is the medical term for small ball that you form with your mouth. So that is my scope. So doing those sorts of things. We can also do accent modification work. But on the pediatric side, which is what a lot of people are more familiar with because there are more plentiful pediatric SLPs, you see them a lot in the schools. And so they do help a lot with articulation and language development. People who may have kiddos who are disabled, kiddos who have autism and may need help with just pragmatics and social things and things of activities of daily living, or ADLs as we call them. And so we have a very vast scope, and that's there are also niche areas like voice specifically. So if you have nodules on your voice, or if you are a professional singer, or if you are a professional speaker, paying attention to voice care is very important, your vocal hygiene. And so I always say my scope of practice is from like the top of your head to like just at your chest level, because that's, your trachea and where your food goes when you swallow. And so there's a lot that goes into what we do, but a big piece is that cognitive rehabilitation piece. And so many people, unfortunately, even medical doctors, don't know the scope of what we do. And so I'm doing my best to raise the awareness so that more people can know what we do and know who to ask for when they're in situations like needing help for concussion and referrals.
Yeah, no. So I can truly appreciate you looking in the mirror. Truthfully, that's what it is. You look in the mirror like, hey, nobody really knows, can connect that in terms of how these two things are connected. And so you say, I want to start my own nonprofit. Right?
Yes.
So
kind of voluntold. Ebony was like, get it together.
You need Ebony. You need somebody.
I need Ebony. Right? Yes, I do.
You need that type of person that's going to push you to say, hey, you can do it, but this is what you need to do.
It was kind of like you better do it, but she's motivating.
You better do it.
She keeps me in line. Yeah.
That's what we need, people in our lives to help keep us in line, accountable, those types of things. So you started your nonprofit. Talk to me a little bit about that process and how that was for you.
Okay. So let me see. This was in February when I did this keynote or featured guest speaker. And from there, I've always been passionate about it, like I said. So from there, I was just kind of like really riled up and excited. And I had all this energy and I'm like, yes, like how can I, do more talks? How can I get into different spaces? And that's when I called Ebony. And she was like, nonprofit is how you can, really create a vehicle for doing this. And so from there, it was, logos and registering with the state and figuring out the 501c3 space and all the boring stuff. Yeah. But, from there, it was just getting on the road and getting in front of any audience that I could. And then Brain Talk Day, that was developed. I hadn't even planned on doing it that quickly, which is very, I am a person of faith. So I'm just like, God has me on assignment. Because for me to have the idea in like March, like very early on, and then for it to come to fruition in November of the same year was nothing but him, in my opinion.
Sure. It's definitely divine alignment, all those different things. And then the thing about the people that came along the way is like, right? So,
like yourself.
Exactly. So if you didn't have, and that's honestly, that was around the same time I also had like left my full-time job and I was kind of figuring things out too. So it's like, if you wouldn't have stepped out on your own faith in some regards to believe in that idea, those opportunities to connect, et cetera, to educate people would not have been a thing. Right?
1000%.
So I'm grateful for that. Absolutely. And so since you're talking about Brain Talk Day, let's go ahead and talk about Brain Talk Day. Okay. Let's go ahead and talk about it, geek out on it. Tell the people, what is Brain Talk Day? What's the purpose? Let's just start there.
Okay.
What's
all right.
the purpose of Brain Talk Day?
Gladly. So Brain Talk Day is my community offering to the public. It's a free event. And it is essentially, for those out there who remember DARE. So that was a program where it was teaching young people to say no to drugs and dare to be different and all of that. And, there was a resource officer that would come and teach it. And you got these workbooks and all this stuff. And it was, I think, multiple days. But I don't remember everything about it. But I remember, that what peer pressure was and the things that they, the gems that they gave me and that I that have stuck with me to this day. I want that to be what Brain Talk Day is for young people in the community. That if you don't remember everything about tau proteins and dendrites and all the nerdy stuff with the brain, if you can remember the signs of a concussion, or that a speech therapist can help you, or adding specific people are asking for referrals to specific professionals like chiropractors who also specialize in concussion care, and neurooptometrists who help with that vision component. A lot of times you hear about concussion and people will say, oh, my vision is blurry, or it's harder for me to read, or sensitivity to light. There are people, experts for that. But you may think optometrist, you may think nothing, you may think general practitioner. But there are specialists, and I want people to know about those, and I want them to know how to make the decisions that are best for themselves. I know people hear doctor and they hear concussion and CTE, and I have unfortunately cleared a room. I went to the Black Student Athlete Summit, and as soon as they saw that, I felt really good because the room was pretty packed, and it was down to a trickle by the time I took the stage. But I understand that people, this is a tough pill to swallow, and it's tough information to hear. But I don't want people to think that I'm trying to scare them. I don't want people to think that I'm trying to force them to stop. I really just want people to have the information, and they can do with it what they will, make the best decision for themselves. Because with sports, and depending upon the different levels, there can be way more poured into it of survival and family support and, all of that versus having some fun and learning about team building and responsibility. Right. So there's a huge spectrum for that. But the consistent comment that I get across the spectrum is, oh my gosh, I wish I would have known. And so when I hear that, I know that it may not be too late, but there have definitely been things that could have been changed had they known the information earlier. And so I really am working hard to make sure that all the athletes and all the people who are at risk have this information so they can at least be aware and use the information in the way that's best for themselves.
Yeah, absolutely. And that's what I would say too when I think about Brain Talk Day. So when I went to it last year, I was a part of the panel, but I also got the opportunity to just watch and learn. Right. So when you did your presentation, I learned so much more about the brain that I had no clue about. And the one thing I will always give you your props on, I think you talk about concussions, but you don't do it in a way that's demeaning. Right. I think that you do a good job of understanding the lived experience. So like what you said, some people are doing this because this is the only way that I've known. This is all I've been doing. And this is my dream. Yeah. Right. And so you don't really take that. You don't try to make somebody feel bad about, oh, you're playing football after learning this? It's your choice. Yeah. At least I'm giving you this information. Do it what you want, right? Do it what you want. At least be educated on it, right? So that you're not just making this unconscious decision. So that's what I always appreciated about it. But like I said, in Brain Talk Day, I learned so much more about the brain. For some reason, I used to think the brain was like a hard structure, but you have like this graphic, if I'm not mistaken, and please correct me because I am not the expert.
I got you.
But like the brain is like soft, and it's almost like, think of it like in the cartoons where like the brains were like in this jar and it's kind of like swishing around.
Yes.
And like fluid. So I don't know, talk about that a little bit more too.
So yes, the brain is not hard, but it is kind of jelly-like in that it is a solid, but it's mushy and it's squishy. But it's also in a hard shell, which is our skull. Can I give my analogy about the egg?
Please. Please. I'm excited I like learning.
So all right. Please, well, hopefully the listeners get something from this. So I love this analogy. It's my favorite. And it really helps to bring it home for those who are probably trying to connect the dots for what it is that I'm talking about. Sure. See what I did there? Yeah. So the brain, I liken it to a raw egg because like a raw egg, the brain is not fixed to the skull. So a raw egg, that yolk is not fixed to the shell. And so if I were to have the shell is, of course, a hard structure on the outside. But what's different is the skull is not smooth on the inside. A lot of people will think about that skeleton that they may see in science class or in a book or something, right? Nice and smooth, that eggshell color. But on the inside, it's very cavernous and sharp. And so if you are sustaining concussions, especially repeated concussions, then you are increasing potential injury because you could be having tiny little pricks and brain bleeds that are taking place for your brain. I know, I'm sorry. I can't, I'm sorry.
It's okay. No, I'm just
He's wincing.
I'm like, oof. Yeah. But still.
It is what it is. Yes,
it is what it is.
Yeah. But if you were to take a raw egg and you were to shake the shell, the yolk on the inside is going to shake. And so just like the egg for the brain, if your brain is rattling around, you're shaking your head or you're taking impact, then is that brain going to shake?
Yes.
Yes, it is. So it's not fixed. And so a lot of people have, unfortunately, a false sense of security with helmets, also a false sense of security with guardian caps and things like that, which, now things are coming out that guardian caps are not as helpful as they initially promoted. So adding the weight of that to, somebody's head, that just increases. Yeah, it can make it worse. And then you think about children who are playing, they don't have the structure of grown adults. And so you have musculature and, bone structure that can't support, those kinds of impacts, especially repeated. And then you add additional weight from something like a guardian cap on top of that. And you could increase, but I don't have those stats, so I will just, say, possibly. I'm not saying this as concrete, but those are concerns. But I say all that to say people have that false sense of security of, well, I'm wearing a helmet, I've got the Q collar, or I'm, wearing the most expensive helmet that they could, that I could purchase for my child or for, the program, and the brain is still rattling on the inside. And so people should understand that helmets were made to prevent skull fracture and not to prevent concussion, brain injury, CTE.
Yeah, and the unfortunate part about it is I don't think there's anything that can really truly protect the brain when it comes to a physical sport like football. And I think we've had this conversation before, but you asked me would I do it all over again? And I said, yeah, I'll do it all over again, 100%. I just have the information now to kind of help support me and basically also be able to help support others. But when I sit back and I think about it, you're right. There is helmet, sure, it protects my skull, but it does not protect my brain. And that's kind of the unfortunate part about it when you sit back and you think about it. But can't think about it too long. But like I said, I'm educated more than anything. And so I definitely think that I could talk to you for like a couple of hours just on brains and I definitely have questions I want to geek out about, but I want you to continue to just kind of not close this out, but talk about what can people expect when they come to Brain Talk Day. And then also the second annual Brain Talk Day is coming up. So let us know a little bit more about that. Okay.
I do want to add one little piece about the helmets.
Okay.
I was recently at an event where I was able to meet with or speak to a rep for a company who provides football gear for athletes for an entire school system. And so I don't know if that's a district or system, but either way, I found out that the helmets that are rated as 5-star, they are lab tested. And so when they have these rates on the website and they're like 5-star, this is the best helmet that we have, that's why it's so expensive. They're lab tested, which means that they are in a controlled environment and they are basically hitting the helmet or doing whatever tests on the helmet. Okay. It's not on an athlete. It's not during a game.
To say.
Yeah.
I'm like, hold up.
And so they have found that when they, sell these 5-star helmets, that particular helmet that I'm thinking about, when it was actually in play, it dropped to a 2-star rating.
Oh, wow.
So I say that so that, parents, athletes can do your due diligence, do your research, and what you see on the website, I would dig a little deeper if you can.
Wow.
Yeah.
You know too much. You absolutely know too much. Like when it comes to brain health and things of that. Yeah, you just know too much because it's like, so I remember when I used to work at a car wash, right? So when I worked at a car wash, every time I'm out driving, I could spot a dirty car like that, right? And so sometimes I think that our jobs inform, how we see the lenses in which we see the world, right? So like I can imagine that you might have conversations with people, one, for how they might speak, And then two, like maybe you can kind of tell if there's cognitively something going on, right? And so it's like for you, your brain is always working, probably assessing and trying to find ways to support people in that. You know?
Yes. And also because I can see what other people can't see, it adjusts my reaction to people. So if someone, has a reaction that is kind of like, that wasn't called for, it could be overly aggressive, it could be, nonchalant in a situation that's more serious. My first thought is something going on with their brain? What could their, background or their history be? But traditionally, society will look at somebody like that and be like, oh, you a-hole, or, what's wrong with you? Or there's more of a lack of understanding. And I talk about this when I give my talks, that we have visual cues for people who have physical ailments. So if you have a sling on, or you're in a wheelchair, or you have a missing limb, there is a patience and a consideration that is allotted to those people that people with an invisible injury, like a brain injury, don't get. So that's another reason I want the awareness, which is why I say everybody needs to know this information. One, to be able to identify the signs and symptoms in yourself or a loved one, but also to be able to have that patience with someone, because it could decrease the risk of a road rage incident, of, someone being upset at a grocery store, or yelling, or, approaching a situation of it could really be them, and it could be that they're overstimulated or something like that. You just never know, and just have a different approach or opinion or consideration when you're interacting with someone. Last thing I'll say is I've been working on getting speech therapists on the sidelines of different events. I wanted to see what concussion protocol looks like in different settings, in different sports. And I was approaching the sidelines of a football game. It was a night game at a high school, a very nice high school, real turf. And two of the players had on sunglasses. They had on their jerseys, they had on shorts, they weren't dressed out, but they had on these dark sunglasses. And another speech therapist that was with me, who was interested in the space and wanted to come along, she was like, oh my gosh, these two kids, they think they're such hot stuff out here in a night game wearing these glasses. And in my head, I'm like, they probably have a concussion. Yeah. And so sure enough, the AT, or the athletic trainer, she was like, well, these two, they're here to support, but they can't play because they just got concussed this week by their own teammate. And so when I talked to that teammate, he was a quite large gentleman. Oh, yeah, I would not be surprised if he was pushing 300 pounds. And he told me he does not believe in concussion. And he says, I get headaches all the time. I just take Advil or Tylenol or whatever I got, and I just pop it and just shove it down and keep going.
I hate to hear that.
There are a lot of people who think like that.
I don't believe in concussion. I'm like, what? Yeah, I don't know. It's too much information nowadays. And I've been around the sport, especially football, one of my teammates, he had some really bad concussions one time. And it was to the point where he couldn't even come outside. He had to stay in his room because he was like the light from and he was walking, it's not funny, but he was walking around with these really thick glasses on. And it's just hindsight, he was trembling. And I'm laughing about it, but it's hindsight, I'm laughing about it. It's just of his whole demeanor and how that impacted him. Yeah. And so I think that, I don't know. I think, what is a concussion? What is
it? Concussion is a kind of a traumatic brain injury. So it comes from a bump or a jolt or something that basically displaces or starts to move the brain. And then from that, there are different kinds of breaks and tears and damage that can be done to the different pieces of your brain, those neurons, the axons, and all those different things that make us who we are. And then when you get into the repetitive head injury space, I'm nerding out a little bit here.
No, please do.
There are these things called tau proteins in our brain. And so when those end up damaged, they misfold, and that kind of turns into a traffic jam of the different nutrients, blood, and things like that need to get to the different parts of the brain. And so Dr. Bennett Amalu, who was the neuropathologist, who discovered CTE, he described it in the movie Concussion with Will Smith that came out in 2015. He described it as if you imagine a kitchen sink and you were to pour wet cement down the pipes and you allow that to solidify into concrete. I always add this little piece. If you were to turn on that water, would the water get through to the other side? No, it wouldn't. Yeah. And that is what CTE is. It essentially chokes the brain from the inside out. And so a lot of times when people are like, they just don't act like themselves and they're acting so different. Well, if the parts of your brain that make up who you are being deprived of nutrients and they essentially start to die off, then yes, you are going to show up like somebody else because you're not the same person.
Wow. So I saw this podcast, Greg Olson. He was on this podcast and he was talking about CTE. And NFL players, by and large, are the ones who are often diagnosed. But somebody asked him the question about, I think there's this stigma with CTE where like you find like a guy who might unfortunately did something wild, maybe harmed somebody, harmed himself, and then they figure out, oh, this guy had CTE, and they blame CTE because of it. But one thing he said that I thought was pretty interesting, and I agreed with it, was that sometimes those guys typically had things happening in their life prior to those situations. So yeah, they might have had CTE, but they also may have been battling mental health issues. They might have been through some severe trauma growing up. And so it's like they never really probably had the other support that they needed. And it kind of just like this perfect storm of a tragic situation coming to unfold. So I guess I bring all of that up to say is that like we hear CTE a lot, but one, what is CTE? But then two, does CTE make people do wild things? Like wild isn't necessarily the word I want to say, but does CTE cause people to harm themselves or harm others?
1,000%, yes. So you want to dive into CTE specifically?
Yeah, so I guess you could give a brief over what is CTE, just for folks who might not even know what that is. And then I personally want to know about, like, do you think that it causes people to, do harmful things or of that nature?
Okay. So I do want to say you are absolutely right. So for people who have CTE, for people who have a concussion, I always want people to know we're not getting sterile brains. We're not getting brains who have not, had a bonk on the head, maybe had parents who were divorced and dealing with that, depression, prior to even taking the field or the court. It's not just a football thing. There could have been things going on mental health wise, like you talked about. But adding to that what's going on with their brain with repeated hits aids and progresses more drastically that kind of damage. So CTE stands for chronic traumatic encephalopathy, and it is essentially what I just described of those repeated head injuries and the sink analogy and how the brain is basically deprived of those nutrients that it needs to thrive. I mean, even if we don't get enough sleep, we can be groggy and our brains don't operate the way that they need to. But when you look at concussion, one concussion can completely change your life to where you have a hard time with finding your words, you have a hard time with sequencing things, following directions. And these are things that we take for granted. If I were to say, hey, Matthew, can you, run out to my car, grab my cup of water and then bring it back? I want to, talk to you about what we're going to cover next in the podcast. That's a lot of steps. And you probably would be able to do that. But if you consider somebody who's had repeated brain injuries, they are going to have a hard time with that. They may only remember, okay, go to the parking lot. And then they could get out there and it's like, okay, what do I do next? Yeah. And then it really, really upsets me when I see athletes who are getting, punished or yelled at or embarrassed by coaches because the coaches don't have that awareness or understanding. And so I see, face masks getting grabbed and, this is why you don't listen. This is why you don't get play time, run a mile. You don't get to play, like just all these consequences. And it's like the athlete really may be trying, but if he doesn't have the awareness to advocate for himself and say, I've only got a 2-step direction brain right now, and this is the most that I can do. And even if the coaches knew that, there would be ways for them to communicate, for them to get, the plays and the exercise and drills out of these athletes that they're looking for. But so that's what CTE is, with, the brain essentially not being able to get the nutrients that it needs. But yes, because of that, if, your frontal lobe is in the front of your head, that's your decision maker, your impulse control. And so with you taking hits to the frontal lobe over and over again, you think about that in practice, think about it in scrimmage, you think about it in an actual game. And then, well, now how is your impulse control? Yeah. Because any little thing can trigger that. And it could be, you gave me a pen that was blue and I was hoping it was red, or you spilled a drink, or you stepped on my shoe, Aaron Hernandez, or spilled a drink on my shoe. And, I could that could result in someone getting killed. That could result in someone getting beat to a pulp. And I call it a CTE episode because I honestly don't think that the athlete is consciously doing those things. And I think that's also how people can say, like, I blacked out, I didn't even know. I've gone to colleges and talked to athletes and have had questions like, is that why I black out every day and I can't remember what I'm doing from this time to this time?
And they say it so like, unconsciously. That's normal.
Yes.
It's not.
Yeah. But that's the thing. It's their new normal and they're dealing with it and they're trying to navigate the space. But there are a lot of people out there like just surviving with it. And even people who have like been in car accidents and didn't know about speech therapy. And they talk to me and they're like, oh my gosh, I'm going to get a speech therapist. And then they do. And they're like, oh my gosh, like things are so much easier. I have less stress. I have less headaches. And so that's our job, to make it easier, to make it better, to help you with your recovery so you can recover faster.
Yeah, I mean, this is, like I said, we could probably have a 3-hour conversation just on that aspect alone. So like in terms of recovery for people who are recovering from concussion, how long does that typically take? And what role does a speech pathologist practically look like in that recovery period?
Good question. So I always say, if you've seen one concussion, you've seen one concussion. They are unique to the individual because, again, we are not dealing with people who have sterile brains.
That's good. So, you've seen one concussion, you've seen one. So everyone's different.
Everyone's different because one person could have been playing hockey and football and baseball since they were 4 and taking hits all the time. And so that is going to look completely different from someone who, jumped off of a high surface and bonked their head one time. Those are going to look completely different. So recovery is going to look different. Their needs are going to look different. So the role of a speech language pathologist is they are going to run you through, or at least how I do it, I'm going to run through every aspect of their day. I want to know, there will be a formal assessment so I call it a map of the brain for me, so I can see where their strengths are, I can see where their deficits are, so I know how to design their treatment plan to get those exercises and compensatory strategies, which is just a fancy way for saying strategies to help them compensate for what's difficult for them. And so I will have them tell me about a day in the life. And I'll say, tell me about a day in the life. You wake up in the morning and then what? So I want to know from the time you open your eyes, what's going on, what's hard for you, what does your day look like? And so oftentimes when I'm with a patient, they will say like, well, I'm just really trying to take it easy. I'm not doing much. And then they will tell me, they'll describe the most cognitively overworked day for someone who has a concussion, from getting startled awake to driving kids to and from school, watching 3-4 hours of television, then getting on the video games with their kids, cooking dinner, running errands, and then, they're, quote unquote, off from work, in some instances. So then, I have a couple of friends come over and, then we're talking and so that is, quote unquote, taking it easy for some people, but that's subjective. So once I hear that, I'm like, okay, these are the things that are triggering. This is why you have a headache that lasts, for days. This is why it's hard for you to focus. And so I will go through all of that and help them tailor their day so that they can, conserve their energy. I use a battery analogy so they can, learn to self-assess, because the goal is not for them to have me as a crutch where, they need me forever. I want them to have these tools and be able to get discharged and progress and live a functional life. But as far as like recovery, that can really vary. The wonderful hope is that you can recover in the, quote unquote, standard time. For kiddos, it's between 10 to 14 days. Adults, it's 2 to 4 weeks. And so if you can recover in that time and get back to your sense of normal, then that's fantastic. And you got a story about concussion to tell. But for those who, have symptoms that last and last and last 3 months, 4 months, that's putting you in the range of something called PPCS, which is persistent post-concussive symptoms or syndrome. And that means that you're just continuing to live with these symptoms and trying to survive. And that's where a speech therapist can come in and help and do the same things. If you're having a hard time with your memory, if you're having a hard time with word finding, there are exercises and drills that we, facilitate to help. We give you homework. And I have had great success with my patients so far. Thank goodness. Thank God.
I didn't mean to cut you
No,
off.
go ahead.
No, I was just gonna say that's like I didn't realize all the things that actually go into helping to recover. And then when you started talking about, people having these mentally draining days and thinking like, and then get to the end of the day and wonder why that you might have a headache, it makes sense, right? Because like the analogy you used earlier of like I had ankle injuries. That was one of my things. I had bad ankle injuries. So if I was on my feet all day or walking around and I get to the end of the day and my ankle is swollen, I could see that. However, what you used about like concussions being invisible injury is like you don't realize how much you are using your brain. And so I didn't realize that either in terms of like how you can get to the end of the day and feel drained and you have this headache because you didn't allow that swelling that's probably happening. You didn't allow it to actually rest. So probably being in bed and doing nothing, staying off your phone and just maybe resting, reading a book, sleeping, doing something is probably the best medicine for that.
It can be, yes, it can be. So we are learning now that it is actually better for you to kind of get back to it to some degree. So unfortunately, the same antiquated advice, recommendations from medical doctors are still being provided to people with concussion. And that is, stay off your devices, stay in the dark and rest, and we'll see what happens. And we're learning now that, yes, get a couple of days of rest, but then you need to be starting to try to, exercise your brain. You think about a physical surgery, they've got you up that day.
True.
They've got physical therapy and they're working with you immediately. And so for the brain, get your couple of days of rest, 2-3 days, but then you need to be starting to try to reintegrate yourself, start to push your limits, see what you can do. But that's why having a speech therapist with you is so important.
Yeah.
Yeah. But that also depends on the severity of the concussion as well.
Wow. So I work with, I'm around a lot of different athletes.
Yes, Mr. President.
Well, definitely as the NFLPA Charlotte chapter president, I work with athletes who might have played and who might have been in the NFL in 1980. And I got guys who just got finished 2 years ago, right? So it's a broad spectrum, and one of the things I recognize is that a lot of for the OGs, I like to call them, their education towards concussion and things wasn't a thing, right? And so like even guys who are my age that I might see like maybe took a lot of hits to the head, it's like sometimes you can kind of see it in their eyes a little bit, like, oh, you had a lot of concussions, or maybe the way they talk and things of that nature. But overall, what I'm getting at is how does a family member, how does a friend support somebody who has played a contact sport like football for years and decades and maybe have had multiple concussions? How do they support them in their life, especially because the way that I think about like brain health and some of the ways that you've put it, especially like with CTE, obviously you can't be diagnosed until it's all done. But if your brain has concrete inside of it and it's choking itself from the inside out, then I think of it as like it's just kind of like a slow deterioration of the brain. And I don't even want to sound too morbid about it, but like how can people around them, how would you suggest a wife, how would you suggest a friend be a good person to these people who have done this for a living?
Yeah. Don't want to be a downer. Imagine how I feel when I'm on stage about to tell these people this information. But that's a really good question. So really educating yourself and getting aware, doing your research, coming to things like Brain Talk Day so that you know how to navigate that space. And even talking to a speech therapist who works with that population. I want people to understand how they can de-escalate a situation, how they can safely remove themselves from a situation, potentially start to see signs of when they're, could have an episode. But that's the thing with CTE and, the parts of the brain that are affected, what's going to set them off? You may not know, but having some tools on how to de-escalate or remove yourself or your children or loved ones from that situation is, I think, the best strategy right now, especially with CTE still being so fresh and new. We only learned about this in the early 2000s. And so there's a lot more to learn about it. And right now you are correct. You cannot officially be diagnosed with CTE until you have passed on. and they can, look and dissect your brain if you donate your brain for that purpose. And then today, if you are alive and you are showing signs, then the official diagnosis now is suspected CTE. And so researchers are working around the clock to try to find some sort of test to be able to identify CTE definitively prior to death.
Interesting.
Yeah.
That is very interesting. That's great information. What's the difference between a concussion and a TBI?
So a traumatic brain injury is the bump or a jolt to the brain. And that can be from a car accident, a hit on the football field, someone getting a tennis ball thrown at their head. And then a concussion is a form of that. Okay. So historically, it has been referred to as a mild TBI. Okay. But now, again, with the research and new things that are coming out, studies are finding that we are needing to move away from categorizing them as mild or moderate, because a lot of times you'll hear mild or you'll hear concussion, and then people are like, oh, it's just a concussion. And I always say it's not just a concussion. Okay, the body keeps the score. Sure. Yes. Yeah. And so you could get a concussion on the playground when you're 9, and then you get another one when you start playing basketball at 12, 16, 21, like they add up. And so now there was I believe they did a phone tree or something where the CDC was going around and calling people who had been diagnosed with a concussion. And they were asking, you were diagnosed with a concussion, then you were sent home from the ER. Are you still experiencing symptoms? And for a year, I think they were doing this, and they found 1 million people that are still experiencing concussion. So it's like, how mild is it if you're a year out or you're 6 months out and you're still experiencing these symptoms? It's not mild. Yeah. So we're, trying to do away with that, because it's misleading, where people are like, oh, it's just a mild concussion, it should be fine. And if you're still experiencing symptoms a year from that quote unquote mild concussion, that's not mild. Yeah, no, not mild at all. I'm grateful. I was never officially diagnosed with a concussion in my career, but good. I'm grateful for that, right? So I can only imagine people who might still have those symptoms. So this is a hot take, but it's a year removed from now. But since it happened, what did you think about the whole Tua situation when it happened? How did you feel about it? And what is your reaction of him still playing this sport? Well, Mr. President, professionally speaking, I think he needs to hang it up. And I think that logically, the NFL has a job to do, and they have a product that they have paid for. And the NFL is, it's not a secret, they are about money. And if they have invested this into an individual, I think that the risk of CTE, I think that is less of a concern. And I think the education of the athletes is, so important, because they deserve to be able to make the decision for themselves and for their family. Brett Favre, he now has Parkinson's, and he has done interviews where he says he can't remember the name, he can't remember his children's sporting events. He doesn't remember the mascots, the games, him being in attendance, the colors of their teams. He said those memories are gone. And I strongly believe that is attributed to his 20 plus years of playing. And as far as Tua, him having those fencing posturing on the field. For listeners, the fencing is where his fingers were looking funny and they were sticking out. That is an immediate neurological response after experiencing a brain injury. I believe typically to the cerebellum, which is a specific part of the brain, obviously. But that's not the first time that picture was captured. So that has happened to him before. That's a really severe reaction. And so I think about practice. I think about, times when he's off of the field, because we're talking about athletes who are doing these sports, but they also drive. Right. They also play with their kids. Yeah. They also could, have a swing, hit them in the head for, a younger kid who's trying to play and thinks it's funny. Yeah. And then you run into the risk of SIS, which we can dive into if you want to. SIS. Oh, is that secondary impact syndrome? Yes, second impact syndrome. Yeah.
I didn't know I did what that was saying.
Yes, okay. Yeah. So SIS, that is where you can have 2 concussions, and it doesn't matter the severity of either. And if you experience another concussion before that first one has had time to fully heal, then you're at risk for SIS, which is where your brain severely swells very rapidly to the point where the tissues of your brain could actually start pushing through those tiny little micro holes in the skull. And the last ditch effort to save you would be to have a craniotomy, and that's where they open up your brain and they take a piece of the skull out so that swelling has somewhere to go. The morbidity rate with that is 50%, but the risk of permanent brain damage is 100%. Yeah. So you unfortunately will never be the same with that. The most recent example of that I can think of was last year. There was a young man by the name of, I want to say Medrick Burnett Jr. And I think he played for Alabama, but on the day before his 20th birthday, so he was 19, he took this hit and he was hospitalized. To my knowledge, he did not wake up. And so it was a big deal in the news because they announced his death while he was still alive. And so the next day is when he actually died. And then they had to re-announce. But this was a wonderful young man. I believe he had transferred from one college to get to another program. And then this happened to him when he was 19.
Wow. That is, that's a lot. I mean, football, not just football, but other contact sports in general, you put yourself at risk. And I think that I've acquired more information about the brain now that kind of gives me, if I'm blessed to have kids one day, I'm not sure if I want them to play football, especially at an early age. I think I'm more of the team. If they want to play a sport like football, I would want them to be a little bit bigger, stronger, that type of thing before they get into it. However, I think this is good information. I think information is good in order to make decisions, right? So this has been great information, but, take with it what you want, right? So I asked this question, though. What advice would you give to athletes, coaches, or anybody who might be a part of a contact sport that would, will help them with their experience? What advice, knowing all that you know about the brain, concussion, et cetera, what advice would you give them that they absolutely need to know?
Educate yourselves. Don't cheat the protocols. Advocate for yourself. When you're educated, you're able to advocate for yourself. A lot of times, athletes, again, a former athlete, you want to play, you want to be on the field, you want to be on the court, you want to support your teammates, you don't want to let anybody down. And so there's a challenge with that for the culture versus what's good for you. And so if you think about a 12-year-old who is not going to make it to the league, maybe you don't go so hard, for the next however many years for that. And having that kind of awareness and education could be, I'm starting to feel these symptoms. I'm, having a hard time in school. My relationships are changing. I'm noticing a shift in myself. Well, if you're educated and you have the awareness, now you have information to make a better decision. And that could be maybe you don't play all 4 years, or maybe you don't play as hard, or maybe you actually report what you're experiencing, because female athletes have a much higher percentage of concussion because they actually report. Okay. And so males, they have the, shove it down, put some dirt on it. It's, deal with it. Yeah, you all right. And they were warriors, gladiators. Yes. Drink some water. Yes, drink some water, whatever it takes. And so now that I, do these talks and talk to athletes, I've had athletes who have said, I've noticed some changes. I now know what to do. I know the importance of me actually reporting, getting speech therapists, understanding protocols, because there are athletes who will cheat protocols, and there are ways to, skirt the system, and then they pass that on to rookies and other athletes. And so that spreads like wildfire much faster than the awareness of brain health and brain injury. So there's a lot of work to be done.
No, there's a lot of work to be done, but I'm glad that you're doing the work. I'm glad that you answered the call within yourself to educate people more and more. Like I said, if it wasn't for you starting Brain Talk Day, I wouldn't have known it. I wouldn't have known the information that I've learned, right? And I don't know if I would feel as comfortable even having these kind of conversations about it. So it has helped me a ton. And so I'm grateful for that. Yeah.
I'm so glad.
Absolutely. Yeah, no. So, a couple of things before we end this conversation. I like to do a few rapid fires, just kind of like offhand, but at the same time, it helps people learn a little bit more about you as well.
Okay.
So like, all right, this is the first one. I'm talking about entrepreneurship with this one, okay? So as an entrepreneur, what advice would you give to those, particularly in your field or just in general about growing a business?
Start. Yeah.
Okay.
We tend to want to be prepared and have everything lined up and your ducks in the row and all of that. And that is wonderful. But for entrepreneurship, there is no, there are going to be things that you're not going to learn until you're in it and having to figure it out. Yeah. So my advice would honestly be to start. Everybody wants it to be perfect, that perfect, I've got everything, figured out in this binder.
Yeah.
The binder can be a really great piece and an asset, but what happens when these curveballs start coming at you and it's all on you?
The binder gets burnt real fast. Right?
Yes. The house is coming down and you're flipping through this binder and you're like, it's not helping.
It's like on page 7,
right.
I was supposed to do this.
Right. I know I highlighted a section here. Yeah.
No.
Start. Just start.
I love that. All right. So next question is, what do you do to stay grounded?
Boundaries. Boundaries and peace. Okay. Yeah.
Boundaries are, without boundaries is chaos.
Correct. So, and I need that peace so that I can navigate and do all the things that I do. I wear a lot of hats.
Yeah.
And so having that boundary of, downtime for me, I have what I call nothing Saturdays. And that's where I just shut it down and I don't do anything. Because like you said, my brain is constantly going, constantly assessing. People are, professionally sliding into the DMs, asking questions. Hey, this happened to my mom. Hey, my kid is, X, Y, and Z. And I want that. I want to help people and continue to raise this awareness on whatever platform I can. And in order to do that, I need to have a full cup so I can pour into other people. And so to make sure that I do that, I do my very best to have at least 24 hours where I can completely shut it down and pour into myself.
I love that. Boundaries are so important.
Yes.
All right. So if you could go back and tell your younger self one thing, what would it be? Don't
let your fear outweigh your faith. Yeah. Because we, as humans, we can want control. And if we can't, know what's going to happen, is this going to work out? Should I do this? Fear can paralyze you. But if you, relinquish that control and you trust your faith and know that God didn't bring you this far just to bring you this far, you're on assignment. There's a reason, there's a purpose. Even in the hard times, you've got to find the lesson in that. But just not letting fear paralyze you and prevent you from doing something that you were, destined to do. Absolutely. I've always heard somebody say you're either moving out of fear or you're moving out of faith. So one of the two, you just kind of have to choose, but they both are strong forces. So. Yeah. They both are strong forces. All right. For the faith. Got to, right? So what's something people would be surprised to know about you? They're always surprised to know that I ride motorcycles. I am a legitimate adrenaline junkie. Look at that. And maybe it's because I'm always analyzing and processing, and that is a good way to free my mind. If you're jumping out of a plane and flying towards the earth at 120 miles an hour, you're focusing on learning how to breathe. Yeah. With all that air going up your nose. And then it's just like that peace. And then riding motorcycles is just a really great, it sounds funny, but relaxation. We call it road therapy. Wow. Or wind therapy. And I'm positive that you wear helmets, obviously. Of course, right? Yes. So what's funny though? I told you I would go back and play football again. And you would probably never touch a football field in your life, but I would never. I played flag football. Okay, we were champions in high school. Thank you very much. Vance Cougar, shout out, class of 05. I apologize. But what I would never get on a motorcycle. I'm afraid of motorcycles. I'd be so afraid to get on a motorcycle. Are you? I would be so afraid. I wouldn't want to do it. Oh my God. I do like adrenaline. I would go jump out of a plane, but when it comes to riding a motorcycle, I'm just like, nah. Oh, man. I'll watch and observe. It's kind of like the plane. It's kind of like jumping out, but you get to control it. And I won't say all the fun that I have on the motorcycle, all the legal fun that I have on the motorcycle, but it's fun. Oh, you're not the ones that be on the streets doing... I know a couple of stunts. Okay. Doing wheelies down Tryon. Right? I don't do the wheelies, but I have gotten more conservative with my riding as I've gotten older and with this work that I'm doing, because I will, even my patients are like, you've got responsibilities. Don't leave us. You have to be safe and good. So I take that very seriously. So I've modified the way that I ride and how often I ride. I've also been very careful and cautious about how I am when I get into like large crowds, because I do have to consider COVID and long COVID.
Sure.
I treat patients who have long COVID. And so I can see the severity of it to where it's like, oh my gosh, even remembering, did I wash my hair? And the only way they can tell is if they look in the mirror and see, or if they look in the tub and check. Taking 3 hours just to get ready because of the sequencing piece that I talked to you about. Like, okay, you've got, undergarments and a shirt in your hand. Which one comes first? How do I put it on? So like your brain can significantly be, there are deficits that can come with long COVID, and it likened the symptoms to a concussion because of the inflammation that happens in the brain.
Absolutely. Wow. I didn't know that.
Yeah.
All right. So last question for you is when it's all said and done, I think every day we are writing chapters in our book, writing pages. When it's all said and done and your book is done, it's closed, what is the biggest takeaway somebody could get from reading the book of Dr. Kelli?
Specifically, like professionally speaking?
Nah, just from your in life, professionally, generally, like what would you want people to take away from your life?
Do what makes you happy. Yeah. I think the world would be a much better place if people were doing what made them happy. And I think there would be less, crappy people at work. There would be less road rage. There would be less anger. If you're in a space of happiness, like I love what I do. I surround myself with people that bring me joy and that are positive. And I, set boundaries so that I don't have to be exposed to toxicity and hate. And so when you create this place of peace and happiness for yourself, and you go to work and you also have a place of peace and happiness and you love it, I think that makes for a beautiful life. And if we had more people like that who were choosing what made them happy, we would have a better world and a happier world. I think there'd be less wars and, less people incarcerated and all the things. So yeah, absolutely do what makes you happy. Do what makes you happy. I received that. I'm going to apply that to the rest of my day. Yes, please. What makes you happy. I want to say thank you so much for being on this episode of Journey Line Podcast. I'm excited for people to hear this information, receive this information. I think it's so helpful, healthy, all the things. So how can people stay in touch with you on social media? And please give us the rest of the details for Brain Talk Day. Okay, absolutely. You can find me on the socials. On all socials, I am Dr. Brain Talk SLP. So that's, Dr. Kelli, DrKelli, Brain Talk SLP. And a little bit more about Brain Talk. And you can also check the website, which is braintalkfoundation.org. And you can also follow the Brain Talk page on all the socials. It is Brain Talk Foundation. So Brain Talk Day is happening again, our second annual. Very excited. Sad you won't be able to be there, but you'll be missed. And it is Saturday, November 8th. It's going to be from 9:30 to 3. And it will be a greater version of last year. So we will still have our panelists. We'll have different breakout sessions. So we're doing 4 sessions. We're doing one with this amazing company called True Brain. Okay. And they have this new cutting edge, very innovative technology where you can essentially wear a kind of soft cap and it can identify what's happening in your brain in real time. So the way it was described to me is like making an X-ray like a movie. So if you're like grinding your teeth or something, it can show you like what parts of the brain are being affected and lit up and all that. So I'm really excited for that session. My line sister, the wonderful Shalandra Quarles-Moore, she is going to come and talk about mental health. She is a mental health therapist and she actually provides services to the NFL Players Association. So she's looking out for your guys. Yeah. She's going to talk about mental health. And then we're also going to have a masseuse. We're going to have your friend, Chauncey Haney. Yeah. He is a former professional athlete and he is a yogi. And so he's going to come and talk to us about stretching and health for that. And we're also going to have a keynote speaker, Dr. Elena Davis, who is actually my brain bestie. Nice. She is the chair at Howard University, their speech program, right? So I'm excited for her to come down. She's going to bring her students. We'll have some Howard students coming down. And the night before, we're actually going to get the students together and like watch Concussion on the big screen on campus and have dinner and a movie and give them a tour of campus. So it's going to be a lot of fun. We'll have the concussion simulation goggles out again and activities. There's going to be a scavenger hunt this year, obstacle course. and just keeping it active and fun. And hopefully it'll be a memorable event. We'll have some good giveaways, and while supplies last, everybody, so get there early. But it should be a good time. Everybody seems to really enjoy it, so I'm happy to put it on a second year.
Awesome. I'm excited for it, and it's the Old Testament that if you build it, they will come. So
Amen to that.
That's exactly what it is. You built it, people are showing up, it's growing, and it'll continue to grow. And I'm speaking over that. So thank you once again, Dr. Kelli. I appreciate you, and this was an amazing episode.
Thank you. Thank you so much for having me. It was my pleasure.
Absolutely.